you're talking about well-being and psychosocial aspects of work, like this kind of comes under the realm of health and safety when you're looking at, health and safety at work now. The psychosocial hazards come under that realm now as well. And it can be sometimes, and I've spoken to health and safety managers, and it's something that they're not comfortable with. It's something that they shy away from. They would rather nearly let sleeping dogs lie, you know what I mean, rather than actually probe that space. So I can get from there. I spoke with one client one time, and he said, look, if I send out questionnaires, which is typically advocated as the way to go to try and find out what the stressors are in an organisation. He said, if I send this out to 5,000 employees, I'm going to get 5,000 problems back and suggestions, and I don't have the time for that, you know. So I can get why there's a reluctance, you know. And I've worked with health and safety managers as well who are in an organisation, but they're not given the autonomy. They don't have the power to actually have, impactful decisions. They're kind of presenting what comes out of workshops to the senior leadership teams, who, when you meet them face to face, their intentions are good, but they have so many things pulling at them. And when the outputs come from some of the workshops, they have other priorities and they just don't follow up. They don't see it as valuable, and as important. And I don't know, I suppose when you look at the bigger side of things, you look at KPIs, what's important right now? How is this person's success measured? And this is where the emphasis is, do you know what I mean? And if it's on, depending on public or private sector, if it's on shareholder value and productivity and expanding markets, that's where the priority is, not so much so on the well-being. But I think we're seeing in the last year the impact of poor well-being on people, can be detrimental to businesses as well.